Just Visitor Hall's not allowed to ask very many questions.
I have another question. I have another question.
He's in the queue, but this is fascinating. It appears to me from what I've heard that we're maybe making this more complicated than it needs to be. And I would like, with the permission of the chair, to ask the forensic pathologist to respond to that same question that was asked by my colleague, Senator Hall. In your view, does this bill require hiring more physicians by counties to fulfill what this bill would do, which you had earlier said would codify best practices that are currently utilized? So if you could answer that question.
Yes, I'd like to answer that. Additional physicians would not be needed. As you heard from the coroner's and sheriff's testimony, they already have physicians who do autopsies in all the cases and determine the cause of death. And in my experience, in 99.9% of the cases, they will come to the physician to determine the manner of death, or they will use guidelines that were put in place by the National Association of Medical Examiners, which is a medical organization run by physicians. So with regards to the additional investigation issue, we are already doing that. Forensic pathologists do look at the videos, do review the medical records. In fact, the coroner's administrative staff and the sheriff's deputies are not qualified to review medical records. They get them from the hospital and they hand them to me. And I'm the one who reviews them. I'm the one who comes to the conclusion of whether they're significant or not. I'm the one who determines whether the hammer blow is the cause of death or just a superficial glancing injury. And with regards to the manner of death, they're hand in hand. The manner of death is also a medical determination. If you have a cause of death and a manner of the death that don't coordinate with one another, and if the doctor gets on the stand to testify, whether it's in a criminal case or in a civil litigation case, because those are also outcomes of what we do, falls, accidents, medical malpractice, injuries on the job. These are all things we have to testify to. And if the death certificate manner is being determined by someone other than the doctor who did the autopsy, it creates confusion for the DAs, for the civil attorneys, and especially for the grieving families. It doesn't happen that often because in the majority of cases, they will come to us and ask us, what's the manner? But in the rare cases where they don't, it becomes a serious problem and a real devastation to family members.
Thank you. And is it fair to say then that in your view, this bill codifies what happens most of the time and also represents best practice in this field?
Yes, it does.
Thank you. Thank you, Mr. Chair.
Senator Hall, I'm assuming.
Yes, I'm just interested in as to why law enforcement's presence is optional. And why is it optional at the discretion of the pathologist?
Are you asking me? Or
whoever the expert is that can answer a question here.
I can answer that.
We've got all these great minds. Somebody should be able to answer it.
I'll answer it. Law enforcement is not optional. Obviously, we need law enforcement. We work hand in hand with law enforcement. The coroners and the sheriff's deputies and the people that we rely on to get information and to collect the evidence are going to be allowed in the morgue. This is, again, for the rare situations where we have had experiences with law enforcement officers who are not authorized to be in the morgue, who are brought in as a large group, either to view an autopsy or they're brought in because of an interest by that particular agency, and the pathologist has found them disruptive or potentially putting themselves in danger by fainting in the morgue. That's happened to me with officers who have come into my morgue and fainted while I was performing an autopsy, and I did not have the authority to be able to ask them to leave. And I've had situations where I've asked them to leave and they haven't.
So in effect, you're just basically saying you don't want law enforcement in the room.
No, that's not what I'm saying. I'm saying that law enforcement officers that are a disruption, the pathologist, the doctor, if you were having surgery, you don't want random people coming in on your surgery. This is a medical procedure. There are bloodborne pathogens. It's potentially dangerous for the people who come in there and potentially emotionally disturbing as well, and it has legal consequences. So we want to be able to have some authority about who comes into our surgical suite. as physicians.
May I also point out, the forensic pathologists and the coroners and law enforcement obviously work very closely together. The other thing to just remember, and this is really about safety and having accuracy in the autopsy room, but the other thing to also point out is that ultimately the forensic pathologist works for, I mean, so if there's a forensic pathologist that is being, I think, unreasonable and uncooperative and interfering with law enforcement, they would then hire another forensic pathologist and dismiss the one that's being unreasonable. They are employees of are contracted with the county and with the coroner. So what we want to do is ensure that we have the safety of the autopsy room, and also to ensure that we get accurate results. This is about ensuring public confidence, being sure the perception meets reality, that the autopsy results are accurate, especially in high-stakes cases. Thank you.
Any other questions?
No, I just don't think, Dr. Pan, that's easy as you are putting it. I respect what you're saying, but it's not that simple. So that's that.
So I have some comments, and perhaps maybe even become questions. And I was torn when I first saw the bill, and I'm going to support it with the amendments that I've suggested. But let me tell you why I was torn. I understand that Senator Hannibal Jackson had an incident in Ventura County. Okay, but my understanding, the crux of that incident was a physician who was on vacation who called and gave permission for the person to do the work. So I think the physician should be brought up for charges, and it's, I get it. But I guess my question is, other than an isolated incident, is there a problem overall? Because you are going to have isolated incidences in all aspects of business, healthcare, whatever. Is it endemic throughout? I don't know, unless there's a lot of cases out there that just aren't showing up, or we're not hearing about, or aren't being brought to attention. The concern that I had, and I'm glad that you're willing to take out that, because throughout the whole body it says a physician and or surgeon, but the forensic pathologist, preferably a diplomat of the American Board of Pathology. The concern I had with that is that nowhere in statute in the state of California it says that you have to be this person to do this work. An example, a physician who is not a cosmetic surgeon can do cosmetic surgery. Can you imagine if we put into law that you have to be a cosmetic surgeon? I'm sure the cosmetic surgeons would love that, but we don't do that, you know what I mean? So now I think with regards to that could potentially create a problem with workforce issues, because there may not be enough forensic pathologists, preferably at a diplomat of the American Board of Pathology. That would create a problem. Now I understand that, yes, every county has a physician, but not every county has a physician on staff. That what they'll do is they'll contract, they'll ship the body to another county, but at least by allowing it to be open and that they can still have that opportunity to kind of, deal with it. But I still think that we are making a significant shift in policy based on, perhaps, I could be wrong, a couple isolated incidents, but I'm still going to support it. But I do have a question, because there's still an outstanding issue that I didn't have an answer to, but I think needs to be resolved, is the definition of an autopsy, because I hear in our analysis, Dr. Sheridan opined that the following actions do not constitute the practice of medicine and need not be performed by a licensed physician, which is extracting vitreous fluid from the descendant's eyes, extracting blood from vessels, extracting urine from the bladder with a needle, and making an incision in the quadricep muscle to collect samples of tissue. So I still think there's some unresolved issues here, because if we are going to totally rely on a physician who happens to be in a different county, should there not be some ability for that physician to allow a non-physician to do these kind of services that aren't going to be a public, and I'm assuming they've been going on for a while, but that's still an outstanding resolved issue that I want to know if you'd be willing to still address. So.
And if I may, we did recognize the concern about having a forensic pathologist, and we've removed that. The goal here is to just ensure that forensic autopsies are conducted by licensed medical professionals. And granted that the lack of that may be limited, but it isn't clear enough in law so that if someone were to perform an autopsy who was not a licensed medical professional, there is really nothing that we can do about it. That is the reason or one of the reasons for this legislation, so that we're assured that when someone's loved one is undergoing the knife to determine what was the cause of death, it's being done by someone who is licensed and trained. At this point in time, granted, this was just something that we learned about. This was a medical examiner county. Everybody they thought, crossed their T's and dotted their I's. And then when it was discovered through a whistleblower that this wasn't being done, there was virtually nothing other than firing this person that could happen. And to the family and to the community, frankly, it is very unsettling, continues to be. So all we're doing is trying to tighten this into law, make it clear, addressing your concerns. We're going to just simply require a licensed medical professional, hope that it's being done by someone with expertise, but that we clearly recognize there are some of these additional questions, but whether we call something a post-mortem exam or an autopsy, we're willing to continue working on this because, as was pointed out, this could be very simple or it could be very complicated, and we're willing to address all those nuances in order to get to the result that will be, I think, in the best interest of the public at large.
And if I may, I want to thank you so much for the work that you've done and the staff has done. I agree with you that we don't want to be, on one hand, overly prescriptive or in the way that you talked about.
The way it's written right now, it is overly prescriptive, and I think, and that's one thing that we didn't get to address that I think needs to be eventually addressed, because otherwise, I think it could be a problem.
Well, I do think when you talk about frequency of issues, we've heard testimony, and before I decided to author the bill, I've heard from forensic pathologists talked about issues that have happened in the autopsy room. But ultimately, this bill is about ensuring public confidence in the autopsies and the findings, because if that gets eroded, we've seen in various high-profile cases, not only in California but other places, people wait for the autopsy report, right, to try to figure out how do we get Chief Justice, and if that gets eroded, whether it's because you have a wayward physician, like we saw in Ventura County, who is directing people over, from vacation, which then people start wondering, well, are those findings good? Or if you have other situations that happen that then erode public confidence in the autopsy report, which is sometimes one of the few objective findings that you have to present in a criminal case, then I think we develop a serious problem in our criminal justice system. So that's really what the goal of this bill is, and I appreciate your...
So let me ask you a question. Just in general, how we are currently administering autopsy / cause, manner, et cetera, would you say that the majority of the cases are done and or seen by a licensed physician?
Yes, as we've heard in testimony.
So in general, okay? But like all professions or whatever, there's problems. We had a physician, was a licensed physician who was on vacation and abdicated his responsibility to somebody else. Would you say, as a whole, the practice of coroner, cause, manner, is there a problem in the whole system itself?
I would say that there are potential problems. Well, there are problems that have come up.
Is endemic that we're having major problems or lots of problems?
We are having problems that could undermine confidence in the system. That's the concern.
So you think a lot of problems?
Well, I would say is that when you have even a small number of problems that erode confidence in the system becomes problematic for the whole system. So it's certainly not, it's not a widespread, this is happening all the time.
So what would happen if this were statute, and then you still have that same physician go on vacation, and then that person would have been prosecuted? It's still, so you're saying that isolated incidents, would that have eroded the confidence of the public?
Well, certainly, I think if you read the news reports from Ventura County, that has certainly raised issues.
I get it, I get it, but I'm just wanting to make sure that, this is a pretty large, major public policy shift from how we've done it to now, and because you're contending that there's not public trust and there's a problem in the system, and I'm just becoming aware of it, so I'm just wanting to verify if that's, if that's true.
And this is a model we're moving toward that has been adopted in many other places, so we would not be the first by any means in moving this direction.
I think Senator Roth, another follow-up?
Not a follow-up, Mr. Chair. I just want a commitment from the authors that if this moves forward, that you fix what I perceive to be a problem with respect to ensuring that necessary law enforcement personnel necessary to the investigation are allowed in the room during the autopsies, that it is mandated, not permissive.
Very much so. We want to work with the coroners and the sheriffs in addressing this issue because we do not want in any way to jeopardize cases and prosecutions that need to happen. So they definitely want, we want to work with the opposition, continue to work with law enforcement, because this only works when everyone works as a team. So if we, that's why it's very important that we continue to work on this. And I certainly want to work with the sheriffs and the coroners in addressing their issues.
Thank you. Yes, Senator Wilk.
I want to associate my, my comments with those of my colleagues. I will support this moving forward, clearly work in progress. But I have Sheriff Cardiners as well, and I don't think we've had any problems, but I think I'd like to reserve my vote for the floor to see how you progress.
Thank you.
And I will definitely work with the staff. I'll keep everybody on the Health Committee informed, because like when it first came to me, I had some concerns, addressed some of my biggest concerns. I still have some outstanding questions that I'd like to, obviously, because I want to make sure that the system that I think is still working, that there's not an erosion of that system either. Okay. All right, would you like to close, or is that your close?
I just respectfully ask for an aye vote and appreciate the discussion here today.
Thank you. Is there a motion?
I'll move the bill.
Moved by Senator Monning. This is item number 8, SB 1189, due pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Wynn, no. Hall. Mitchell. Mitchell, aye. Monning. Nielsen. Nielsen, no. Pan.
Aye.
Pan, aye. Roth. Aye. Wolk.
Thank you, Mr. Chair.
Thank you.
Currently has 6, enough to get out. We're going to place that bill on call. We're going to do the consent calendar. Item number 6, SB 1100, Monning, moved by Senator Wolk. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Wynn, aye. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
That was arduous.
It was.
Currently, there's 8. We have 1 member absent. We'll put that bill on call. Item, where did I see? Oh, Senator Bell. Item number 7, SB 1113, pupil health, mental health.
Just want to make sure law enforcement. Well, you don't want the doctor responsible for this.
Good afternoon, Senator. Welcome. Please proceed.
Mr. Chairman, good afternoon, and thank you for considering SB 1113. This responds to a key finding identified in the joint legislative audit done on our schools' mental health programs in schools. The audit found that local educational agencies and counties could benefit financially and improve student access to mental health services by joining forces to provide services to the Medi-Cal eligible students. The audit pointed to specific school districts that are actually, as models, financially benefiting from contracting with their home county. School districts such as Mount Diablo, which has been able to access roughly $1.3 million in federal funds per year from its county, and also Desert Mountain SELPA's agreement with San Bernardino County has allowed it to access $4 million in federal funds for the last fiscal year. Although successful models clearly show that partnerships envisioned by this bill both counties, benefits both counties and local educational institutions, districts, they are rarely implemented by the school districts. And that's because the local educational agencies cannot access for the early periodic screening, diagnosis, and treatment services unless they contract with their respective counties. And so some of these agencies in the county disagree over who should pay for the state match, as is required by the EPSDT program. This bill provides the financial incentives for the LEAs to establish demonstration partnerships with counties to deliver quality school-based mental health services to more children. I submitted authors' amendments that address most of the concern expressed by stakeholders and committee staff, and we take those as authors' amendments. I'm happy to continue to work with them, other people, to address any remaining concerns. Thank you. I'll turn this over to our sponsor, the California Council of Community Behavioral Health Agencies, Rusty Seelix, and I'll turn it over to our witnesses. Thank you.
Thank you, Mr. Chairman and members. Rusty Seelix for the California Council of Community Behavioral Health Agencies and Mental Health America of California. We're pleased to sponsor this bill to address the very strong frustrations at the inability to get good school-based mental health services. And it's not just the Medi-Cal students, and it's not just the ones that an IEP is written on. It's all students. And these model partnerships, especially the one in Desert Mountain, what makes it great is it brings clinicians on campus to work with schools at the earliest possible stage to identify children needing mental health care long before they would get that care otherwise. You ask any first grade teacher who are the children who might wind up in special ed, and they know who they are, but they don't meet the criteria until 4th or 5th grade. Studies show that in mental health, it's usually 6 years from the onset of a condition before a child gets help. We had a model program called the Early Mental Health Initiative that ran for 20 years, funding schools to do exactly that. And the Department of Mental Health that ran the program said we never saw those kids again, meaning that they never became special education students. They never failed in school. Those are the kind of partnerships that we think this bill will incentivize, and unfortunately it can't be done unless schools and counties find a way to work together, and this bill is intended to create a funding source to create the financial incentives so those partnerships can be much more widespread than they are now. Thank you.
Good afternoon, Chair and members. My name is Anna Hasselblad with the Steinberg Institute. SB 1113 will allow for partnerships between county mental health and local education agencies to provide on-campus support to identify students not in special education programs who the teacher believes may require mental health services, and with parental consent provide those services. Educators play a key role in the development of the mental wellness of their students and are especially well positioned to recognize the signs and symptoms of an existing or emerging mental health condition. This bill is an opportunity to move away from the fail-first model we have today and give schools, providers, and parents tools and a clear process to address mental health needs the moment they present, not years down the line. SB 1113 will result in better health outcomes for our youth, both in their overall development and in their communities. We respectfully ask for your aye vote. Thank you.
Thank you, Mr. Chair and members. Christopher Castriel on behalf of the California Academy of Child Adolescent Psychiatry. I just first want to take the opportunity to thank Senator Bell for his ongoing efforts in this issue dating back to the audit that was referenced earlier from last year. Just want to associate my comments with Mr. Seelix. The importance of early intervention and prevention strategies cannot be stressed enough. We think this bill does a great job in moving that forward, and we ask for your support. Thank you.
Thank you. Opposition?
Mr. Chair, Alice Kessler here on behalf of the SELPA administrators of California. We have neither support nor opposition position at this time. We did submit a letter with some concerns to the committee prior to the most recent amendments, and we've been working very closely with Senator Bell's staff, and will continue to do so. You know, as was mentioned, the audit did look at how do we increase access to EPSDT funding for LEAs, and that's something that we also support. I think the devil will be in the detail. I think the keys for us are looking at where the funding source would be, and we'll work on that as we move forward to appropriations. And in addition, ensuring that the legislation is not too prescriptive in terms of the partnership, because different local communities have different needs and different aspects of their partnership that work effectively, and those local partners know what works best for them. So we look forward to continuing the work going forward.
Thank you. Opposition? Questions, comments, any of the members? We have a motion by Senator Pan. Would you like to close?
Just ask for your vote. Thank you.
Thank you. We're at item number 7, SB 1113, due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Currently has 8. That's enough to get out. We have an absent member. We'll place that bill on call. Item number 9, SB 1283, Bates Substance Abuse Structured Sober Living Homes.